रायता तो फैल गया, अब देखें इसे समेटे कैसे। अभी तक हमने डिस्कस किया था कि हार्मोनल चेंजेस जो प्रेगनेंसी में होते हैं उसके कारण क्या प्रॉब्लम हो सकती है आपकी ओरल हेल्थ। नाउ विल डिस्कस व्हाट आर द टिप्स एंड ट्रिक्स with the help of which we can combat these notorious issues. Here are a few tips. Brush twice a day. Use soft toothbrush. Use with a gentle pressure. Floss every day. You can use a thread flosser or you can use a water flosser. Try to massage your gums. Eat healthy balanced diet rich in calcium like paneer, doodh, dahi. Also try to incorporate leafy green vegetables in your diet. Avoid or limit sugary snacks or drinks in your diet. Rinse your mouth after every meal. And in case you vomit, don't forget, should not brush for at least 1 hour. And in case you want that freshness in your mouth, rinse your mouth with water. You can put a pinch of salt in it or you can use a baking soda. You can even rinse your mouth with any mouthwash which is alcohol free. See your dentist for the regular dental checkup. And in case they advise you to go for a cleaning, cleaning is completely safe during pregnancy. इतना कुछ बता दिया, पर अभी भी डाउट है? कोई बात नहीं. Leave your questions in a comment section and I'll try to answer all of them. In meanwhile, please do save and share this video with others.